Hi, I am Dr. Matthew Malice. I am a second-year rheumatology fellow at the University of Kansas Medical Center in Kansas City, Kansas. My research project was looking at the coexistence of vasculitides in patients with inflammatory bowel disease. This was a single-center retrospective chart review of patients with an ICD-9 or ICD-10 code for inflammatory bowel disease and vasculitis. The specific vasculitides and inflammatory bowel diseases that we examined are detailed in the methods and materials section below. In the center of my poster, you will find the characteristics of the patients that we were able to identify. We were able to identify 4,100 patients with inflammatory bowel disease at our center. Out of these 4,100 patients, we were able to identify 844 patients with a concomitant diagnosis of vasculitis using an ICD-9 or ICD-10 code. Out of these 844 patients, we were able to identify 30 patients with a rheumatologist or gastroenterologist diagnosis of vasculitis or inflammatory bowel disease, respectively. The rate of vasculitis was similar between Crohn's disease and ulcerative colitis. Leukocytoclastic vasculitis was the most common vasculitides that was associated at 30%, followed by granulomatosis with polyangiitis at 17%, followed by large vessel vasculitis at 13%. The mean age of diagnosis of inflammatory bowel disease was 33.6 years of age, and the mean age of diagnosis of vasculitis was 40.3 years of age. Angus serologies were only present in 27% of these patients. There were a small subset of patients that developed vasculitis following their treatment of inflammatory bowel disease. Using this data, we were able to calculate an estimated prevalence of 730 patients per 100,000 patients with inflammatory bowel disease that would develop vasculitis. In most of these cases, inflammatory bowel disease was diagnosed before their diagnosis of vasculitis. This suggests that vasculitis could be a secondary process from inflammatory bowel disease or the result of their treatment for their inflammatory bowel disease. Thank you for your time and listening to my presentation, and I look forward to the questions you may have.